Hi, my name's John Swarbrick and I'm one of the dentists here at Dental Excellence Harewood. I qualified from Leeds in 1992 and went into general practice, and then in 2012 I was awarded the fellowship from the Royal College of Surgeons, which is the highest degree available to a general dental practitioner. I guess cosmetic dentistry in a nutshell is any sort of form of dentistry that improves the appearance of the teeth. I think it's really important. We use a lot of video and a lot of photography to assess your smile as a whole within your sort of form of your face. And so what we like to create is a unique smile that really is designed to suit you as an individual. I think the main benefits of cosmetic dental treatment that I've witnessed with people is the improvement in self-confidence. I think we've moved into an era now where image matters probably more than it ever has done with the rise of social media and smartphones with cameras on. And now as we move through the COVID era, with people being on video conferencing all the time, you're constantly seeing your image and your smile. The first visit is all about the investigation. It's almost like the site survey. What's going on, what's happened, what do we need to do? Sometimes a second visit will involve then sitting down with you and running through all those options, and we'll have prepared a report for you to have read in between that second visit. And then hopefully at the end of that we can formulate a treatment plan which is clear. I would say traditionally here we're mainly a referral only practice, so it tends to be treatments often in the older generation that I would say have got legacy dentistry. So often it's not the patient's fault. They grew up in an era where a lot of dentistry was done during the 70s and 60s. And it has a shelf life to it, and ultimately it failed. And I guess that's when we come in terms of making sure they maintain their teeth and maintain their smile. It can be life-changing. We have patients who simply cannot eat. If you can give somebody that ability to eat and smile and talk confidently with people, it is absolutely life-changing for them. And I guess one of the most rewarding aspects of the job in terms of what we do. Cosmetic dentistry can take anything from 1 or 2 visits to sometimes years if it's a more complex treatment plan. At the initial outset, the initial visit, we need to understand what the patient wants to achieve, and it can be something simple, but it's important to do the job right and do it once, basically, and that's the thing, that it takes as long as it needs to take to do the job correctly. I guess nowadays the complexity of dentistry means that whilst you can be a jack of all trades, it's sometimes easier to be treated by masters of individual specialities within that. We want that patient to get the best result possible. If that means being treated by 3 or 4 different dentists, we're all here within the building. I guess if you're considering improving your smile and you're interested in cosmetic dentistry, the first visit is always the hardest one. So I'd say first of all, pick up the phone and feel free to have a free discussion with Nikki, who's our treatment coordinator. I've been fortunate enough to be involved in dentistry. As I say, it's 29 years now that I've been qualified, and I still have an amazing passion for it, and part of that is because I'm very fortunate to work within a profession that makes a difference to people. For me, it's incredibly rewarding, and hopefully it comes across I'm incredibly passionate about what I do in trying to make a difference for people.